Oh, hi. Hi, everybody. This is Mo Bandari from Orthopod. I'm with a longtime friend and colleague, Dr. Philippe Leclerc, who is an orthopedic surgeon working in Paris, France. And, he's been kind enough to share with us a few minutes of what's happening in France, the situation, and more importantly, ultimately, what the mood is going forward. Philippe, thank you so much and welcome.
Oh, you're welcome. You're welcome. Thank you very much. I'm very
Um,
happy to speak to you.
So, Philippe, let me ask you this. I mean, France has certainly been on the world's meter because the fact that it's well over 100,000 cases in France, and there's been concern in that there's been so many different, rumors going around about how things are. Can you speak a little bit about the current situation in France?
Yes, it happened 3 weeks ago, approximately. I would say now. I don't have a good memory now because the time is so strange. So
Yeah,
it started, well, let's say 1 month ago. First of all, we didn't believe it. We like a lot of countries, we say no, it's not gonna happen. It's not
yeah,
serious.
right,
And we had election just before
right,
this epidemic problem. So nobody would believe that it would happen like that. And suddenly, sudden rise of patients all over Paris and in the east of France, and it came very quickly. And we were very surprised,
yeah,
and we were very quickly overwhelmed. Okay, we were very surprised. We said no, it won't happen first,
yeah,
and second, it will. We can organize things, and
yeah.
third, we discovered that it wasn't impossible to organize anything. So
Wow.
it was very quick, and we had to stop immediately our surgical program and to reorganize the whole unit. My hospital became a COVID unit only dedicated to COVID. We stopped everything except cancer, a real emergency like bleeding, open fracture, etc.
Yep,
And
yep,
we stopped everything, and we say we had to face a very like a wave. You know, the
yeah,
media say it's a wave, it's coming. We didn't see it first, then we saw it, and then we said, my God, it's huge. And the problem was not the not serious patient. It's that the patient came, they couldn't breathe.
yes,
They have serious problems, so they had to go immediately to the ICU. Okay, so we are a small hospital. We have only 10 beds in the ICU, so we
wow,
had to stop the OT program and
yep,
to take the post-op room and to reorganize everything. And finally, we found 30 beds, 30 beds
wow,
for ICU. And we were very lucky because the 30 beds were completely filled, we
yes,
say,
yeah, yes, yes.
in 1 week. It was completely full.
So were you in a situation then, as an orthopedic surgeon, Philippe, were you then redeploying yourself to serve in other areas where you haven't, been doing
Yes,
that now? So what were you doing?
we did three things. First of all, we said we are volunteer to do anything you want. You know,
Yeah,
we
yeah,
ask the medical staff and say, okay, we don't operate, so we are volunteer for everything. And
yes,
so we divided the this in three. One team was ready to pack things, take the food for the medical staff,
yeah,
and go outside to buy the mask and etc. with the car,
yeah,
okay, like external stuff, we said.
yeah.
And third of the team uh, became medical doctors.
Wow,
They did, yeah. I will send
wow.
you pictures, my God, with a stethoscope and
You have an orthopedic
electrocardiogram,
surgeon with a
and
stethoscope. Okay, you
yes,
get to send that picture.
we were the second line just before the medical doctors to
Okay,
help them in a few things very simple, and
yes.
even to call the family, because this was terrible for the family. Can you imagine your mother going to an hospital
Oh,
and the family cannot visit, and then
no.
she died in the ICU? and we say, sorry, you cannot go. So we use the phone, and we call every day the family, and sometimes we're medical doctors. And as for me, I decide I don't want to become a medical doctor because it's boring.
Yeah.
No, I'm joking. So I said I can be volunteer in the ICU.
Yeah.
So I became kind of, for the nursing.
Yes. Right.
You
Yeah.
said that
Right.
nursing.
Yes.
Yes.
Correct.
Okay.
Yes.
So
Yes.
because the difficult part of the job was most of the patients are male, obese, hypertension, and
Yes.
diabetes. So we had to take them in decubitus, in
Yes.
procubitus and decubitus to change the position. And you can imagine with 30 people, 30 patients, that was
It's a lot of
very
work.
difficult.
Yeah.
So every day we were working, helping the nurses to do the nursing, everything, and PP and poo, etc. That was wow, very impressive. But the staff was very happy to see an orthopedic surgeon in the ICU. They were smiling, They say, and so I saw, even if I'm not specialized in that kind of job, I could see that they were always smiling at me, say, oh yes, it's good, you are here, we are very happy, we are supported, etc. That was great.
Oh, that's wonderful. That's wonderful. So let me ask you this then, Philippe. So when you think about all the things that have surprised you about what happened, what's been the biggest surprise to you about this whole experience right now? Because I mean, you
The
are front line.
the speed.
Okay.
The speed. It came in 1 week suddenly. We were very surprised by this quick disease, because the patient they are in the regular unit, and
Yes.
in 2 days they go to the ICU. And
Wow.
the anesthesiologist and reanimators, you said that? Reanimators, the guy who works in ICU, they say, oh no, I won't intubate this patient. Okay, I will wait. And in 1 hour, hop, he had to make an intubation.
Wow.
So and that was strange, because the patient, even going in the ICU, said, okay, I'm fine, I have some problem breathing, but okay, it's okay. And suddenly, poof,
overnight. Over
going
seconds,
down.
huh?
Yes. So that was very, very impressive. This rapidity. It was very quick.
So let me ask this: when this is happening, Philippe, I mean, I've known you, and you're of all the people I've known, you often took life as like, it's okay, like, we have time,
Yes.
let's stay calm.
Yes.
Was there a sense of like just, I can imagine, like almost panic, if not, when you're seeing all the ICU beds filling up, everyone's being deployed. How did people maintain a sense of calm in this? Because it's almost like it would seem impossible to be that way. I'm wondering on you personally, because I know that, you're a fairly calculated,
I'm a
calm
little
person.
bit used of that kind of situation, because I'm doing once a year humanitarian surgery in Central Africa and in Gaza. So I'm a little bit used to this kind of war surgery. This is not war, but in Central Africa there is a civil war, and you can have rest and be cool, and suddenly 10 one patient, 10 gunshot wound, and you have to manage this. So for me, I was a little bit used, and I say we don't have to think. We have to just act organized and shut up, everybody. Shut up. Go. But I was used to that. I saw, first of all, the few nurses, of course, they were very scared, because they thought this virus was lethal. And in fact, we know that only 1 or 2 or 3% become in the bad situation. But we had to explain a lot, to talk to a lot of person, a lot of people, that this virus, after all, is not so dangerous. It is just that we are overwhelmed. That's all.
That's right.
That's all.
Right.
It's very quick, and a bunch of patients, but that's all. At the end, and of course, we didn't have the mask, as you can imagine. And that was terrible, because we have to be volunteer. So a few people didn't want to go to ICU, and well, it's on your well, how can I say? Well, I was volunteer. I said, I don't care. This is not Ebola, okay?
Yeah.
This is not polio. This is not Ebola. This is,
Yeah.
okay, we can go. Come on. We don't have the mask. We don't care. We are going to wear the mask. So it was a kind of personal decision.
Yeah.
And I could see that the anesthesiologist did the same. They were very courageous. I say, okay, let's go.
Wow. And now, right now, before we got online, you were saying that things are looking a little bit better. So
Yes.
there's a general sense of optimism now. You're
Yes,
over
I am very
so
optimistic.
you've peaked, things have come down.
Yes, we yes.
No, I
We
was going to
reached
say,
we reached a high level. I think that the French epidemiologist, didn't think that it should be so high.
yeah.
But now didn't think that it should be so long, because this respiratory syndrome lasts a lot,
Yes.
like 2 weeks.
Wow.
This is a very long, and
Yes.
the anesthesiologists were very surprised. They say, "My God, in 1 week it should be okay," and in fact, not. And so now it's coming down, because we have 24 beds now in the ICU. That means that 6 patients went up in the regular unit.
Yes.
So we feel very free, because the main concern, first, I would say, it is very rapid. This is very quick. Second, we are overwhelmed.
Yes.
And third, imagine if you go to the ICU, if you go to the emergency room with a respiratory disease, the anesthesiologist will say, we won't take you, because we don't have room. And that was very frightening. Okay, but now it's over. We have 6 rooms free, 6 beds. So we said, okay, we can save people.
Right. Well, that's amazing. And so what do you see now in terms of reentry? So do you see elective procedures opening up anytime soon for you, or are you in this pattern for the next months? What do you feel?
I think we are going to stay like this for 1 month.
1 month. Okay.
9 months, because there is the fear for the second rise of this epidemic. It will probably go back a little bit when people are going to be free to walk in the street. So we must be very prudent, because this is a very quick syndrome. So we are going to probably stay like this for, let's say, 3 weeks or 1 month,
At
like
least,
this configuration, which is very, very boring for us, for surgeon. I mean, we stop everything, and we have to call the patients to say, stay home, don't go to the consultation. We don't know when we are going to operate through, etc., etc., etc.
Okay, last comment. I know you've given it. I mean, it's the way you're telling the story is just quite actually riveting, because you speak with such passion about what's happening on the front line. Philippe, when you look back at what this has taught you, and I know you and I have had many conversations in the past, and I know you think very carefully about what this all means. What do you think will be the lessons learned from this for you personally, or even for our community? Because I know you will reflect on this if you haven't already.
I think this is this question is difficult, because we are just going out from the problem. I would say we have to think to be ready for the next hit. Be ready for the next hit. Keep possibility of having this very quick organization. Okay, we have to stay aware and to be ready to reorganize very quickly. Otherwise, it's okay. I mean, after all, this virus is not so serious. It is just that we were overwhelmed, and that was the only real problem. So we must think about the possibility of reorganization, and quickly. That's all.
Okay. Love it. Thank you so much, Philippe. I can't thank you enough. And we have to find a way to connect separately. I don't want to have Abby here.
Okay. Sorry for my English. It's not so good.
Oh, your English is amazing. Oh, it's amazing. I can't thank you enough.
Great.
It's really awesome, my friend. Go back and continue to do the good work you're doing, and we'll chat soon. I'll send you an email. Maybe we'll set up a separate time.
Yes. Okay.
My friend,
Great.
thank you so much.